The idea of a comprehensive medical scheme for secondary school learners arose out of a survey that the Directorate of Secondary Schools did. In 2017, there was an upsurge in medical cases involving students, accidents, name them. Under the free day secondary education, there is normally a component of 2,000 shillings per child that is given for schools to be able to cater for medical issues and insurance issues of the school and the learners. Having come from secondary as a principal, I know the pain that parents do go when they are told that your daughter, your son is sick, please come and pick him and take him to hospital. One, there is a loss of time for the parent, there's loss of time for the student, and of course there is the financial burden on the parent. So we sat, and out of that now we say that we must find a solution. So we decided to use the same framework that we had in purchase of textbooks, where we pooled resources, negotiated with the publishers, and came up with a low price, and that's how the government was able to supply books on a ratio of 1:1. So that is what actually drove us into again having the same thinking. So the allocation per child from capitation of 2,000 for medical in the year 2018, the president instructed that we must find a way of cushioning parents from FT medical expenses, and therefore we entered into a negotiation with the National Hospital Insurance Fund, and we did an agreement and a contract, and for 5-year contract that is, where National Hospital Insurance Fund would now provide our learners in secondary school with a comprehensive medical cover. This was negotiated thoroughly, and it has specifics on what they cover, and of course there are a few other things that they do not cover. But by and large, it was a more enhanced medical scheme that I would say that even the medical scheme of the teachers, I would say it is somewhat inferior to what the students are getting. One, because of their numbers, because by that time we had 3.2 million learners in secondary. Currently we are talking about between 3.5 and 3.6 learners. So we negotiated for a good price, and it has a medical cover, and it has a group insurance, group accident cover for learners, and the last expense was also factored in. So those are the three areas that this comprehensive medical scheme sought to address, and it has been addressing. If I will maybe answer one of your questions, how does a child qualify? One, because all secondary school learners receive capitation. So the first thing is that they must be receiving capitation, and for them to receive capitation, their details must be captured in NEMIS. So it means therefore that for any child to benefit, they must have the UPI, the unique personal identifier, in NEMIS. We generally, the normal nomenclature is a NEMIS code, but of course we call it a UPI. So every child must have a UPI. Now this UPI that the child has is synchronized with NHIF, and NHIF issues the child with the unique NHIF number, which later on, when they leave school, they can now continue with the universal cover, maintaining the same number if they choose to. The process of accessing medical services or by the learners is such that every school was instructed to choose the medical facilities that are accredited by NHIF. So if a child falls sick, initially the school would do a letter to the facility near them, but nowadays that's not done. What the child needs to do is to present themselves or to be presented by a responsible person to the facility. Then they present their UPI, the name is code. That name is code, or I say that the name is code already has a NHIF number attached to it. So the facilities will key in the name is code, and they will find that the child is covered, under the medical scheme. So they just need to present themselves. Now there is flexibility that again we negotiated, because we have children when they are in school and when they are out of school. This medical scheme covers the child or the student while they are in school and out of school. So if a child, for example, I would use this, is in a boarding school, maybe the school has chosen a facility near them, but during the holiday they are away. So this cover again is portable, so that when they are out for holiday, they can access medical services close to them. The problem that has arisen is that parents imagine that this medical cover only applies when they're in school. It is not so. It applies when they are in school or out of school. So long as they are still students, they are able to access that. Number two, which I do not want to forget, this cover has what you call evacuation. The school does not need to incur expenditure to have the child taken to school. In case of an emergency, an ambulance can be called to evacuate the child. And of course, when we talk of evacuation, we even have overseas evacuation. We have had cases where children have been taken out of the country for specialized treatment when it is not available. Yes, and the stories of Edu Afya is such that it has benefited very many learners who would have otherwise suffered because of lack of proper medical services. In the event that a student dies, the last expense is that the next of kin will receive 400,000. 400,000 shillings, and there's 100,000 for funeral. So in total, 500,000 will be given to the family. So, and of course, there's a procedure on how that money is supposed to be claimed. The burial permit, the birth certificates, and the death certificates, the originals of the same, are normally supposed to be processed through the ministry, forwarded to the NHIF, who now will pay the parent or the next of kin of this student. During admission, the birth certificate is used to generate the UPI. So if a parent does not provide the birth certificate, it will mean that this child will never benefit from this. In the event that he or she falls sick, the parent will shoulder the responsibility. And it's normally very sad that we have students sometimes where we have to capture their details because they are sick. But when somebody is well, they do not consider it as an issue. So the first thing that the parent must provide is the birth certificate on admission. So these details are captured, because the UPI will never be issued until the birth certificate is provided. We have outpatient, where we have the general outpatient services that are normally provided. We have specialized outpatient services. We have routine outpatient services, referral cases. I need to say that for level 5 and 6, and this needs to come out clearly, that in most cases it has to be out of a referral. You cannot admit your child in a high-end private hospital and come and claim that you need Edu Afya to cover you. It has to be through a referral. And the referral, of course, everybody knows what has to be done. There is always pre-authorization by NHIF that if you need to be treated in a certain private hospital, it has to be authorized in advance. In case of emergencies, that is the exceptionals. In case of emergencies, we know that sometimes if there's an accident, students are taken to any available hospital. But immediately, NHIF must be notified that this child is in this hospital. Sadly, we have had parents who admit their children in private hospitals. When the bill becomes too much for them, they fall back to Edu Afya. Now, it becomes a challenge for Edu Afya to regularize something that they were not involved in the first place. So we sometimes go out of our way. Now, the other one that under what we call referral services, we have rehabilitation from drugs and substance abuse. That one is also covered. Renal services is covered, and I would like to say that we imagine that renal issues are not with children, but they're there. So that one is also covered. Of course, we have specialized radiological services, ultrasound, chronic diseases are covered. Cancer medical care and treatment are also covered under that. Then we have dental services, they are covered. Optical with limited scope. One, because it's prone to abuse, but that one, the optical benefits are there. Of course, now when we come to inpatient shall be on a referral basis. You do not admit yourself to a hospital. It must be referred. You must be referred. And that is why we have had issues with parents or guardians admitting their children in private hospitals and turning back asking for assistance. There is always a way that is to be done. So what is covered? We have hospital accommodation, pre-hospitalization diagnosis, doctors' fees, nurse charges, drugs, medicine, dressings, and all that. And of course, the normal diagnostic laboratory services, rehabilitation services. If somebody has been in an accident, even the rehabilitation is covered. Then we have what you call emergency and road rescue. That one is also covered. That what we just need to do is Edu Afya, which is our brainchild, has a contract with the Red Cross, so that at any given time you can call the Red Cross. If students are involved in an accident, Red Cross can be called and they're evacuated to hospitals. Of course, we also have what you call emergency air rescue in areas where we find that our students are very far from hospitals and they require emergency air. That one is also provided for. Overseas treatment, that is another one. Costs arising from conditions that are not or warrant treatment out of the country, they're also covered, and the scope of that is treatment, cost of travel for the patient and the caregiver. NHIF, upon the death of a student, pay the next of kin the amount specified in the limits. Of course, I've given you the limits, and what you need is a duly filled form, a copy of the burial permit, copy of the birth certificate. We usually take the originals because copies sometimes can be used, can be abused. So what we do is we take the originals, and then after payments they are returned back to the parent. Then of course we have the group life cover. So I think which I've also said. Now the group life cover is when a student dies. Now, this is where we require the originals. The other one was last expense, and so that's why I was saying the two are paid together. There's no way you can pay group life cover and not pay the other one, because they are mutually inclusive. So in this one, we require the originals. The original burial permit, the original death certificate, the original birth certificate are required. They are submitted, and both of those two, the amount payable is 500,000. General exclusions, very important for parents to know and learners to know also. Cosmetic and beauty treatment are not part of it. So if somebody wants to undergo a plastic surgery to look different, we do not cover that one. Laser eye treatment or surgery is not covered. Massage is not covered unless it's after an accident. So if it is taken as part of physiotherapy, massage may be given, but usually it is an exclusion. And then the other one is treatment of any injury or disease arising from specified exclusion. Self-injury, you know that one is you cannot be self-inflicted injury. That one is an exclusion. So if somebody attempts to commit suicide, that becomes an issue. You cannot cover that one. So I think that basically that is all about Edu Afya. Mine is to ask the parents to make sure that they know the UPI numbers of their sons and daughters, because that UPI will be used to access the medical services. And before a UPI is issued, they must also know that the school requires the birth certificate. So if a child does not have a birth certificate on admission to secondary school, there are so many things that they are missing out. They are missing out on capitation. And of course, in the event that somebody falls sick, they will also miss out on that one. And medical expense is a huge thing in our budgets. So if you can be able to take care of the medical expense of your son and daughter, that gives you a peace of mind as a parent.